Indeed, Ina Kamosi. It is Island Tuesday. And to all my Islanders locked and loaded right now, good afternoon to you. Thank you for making it Miss Kitty Live right here on Nationwide 90 FM. You can watch me live on Facebook at facebook.com/The Fluffy Diva. We're inside the hour 4 and 5, brought to you by PROMAC, program for the reduction of maternal and child mortality, protecting mother and child. And as I said, well, if you're watching on my Facebook Live, our topic for this afternoon is how important is a father. I alluded to it earlier whilst speaking to Taurus Riley, and of course his father, Jimmy Riley, the late Jimmy Riley of blessed memory, has been a very integral and important part in his life. No, normally or customarily, the focus is on mothers, and of course mothers are very important, but fathers are important too. Boys need their fathers, girls need their fathers, and of course mothers, the wives or the girlfriends, will need that partner, that support system to be there to help them through their pregnancy, and of course even after birth, for them to be there to help to guide and mold and set the tone for their children. I'm always going to be an advocate for family.
Did you know that in the first 3 months or 12 weeks of pregnancy, you need to cut down on your caffeine intake, as this can lead to a higher incidence of miscarriages and low birth weight babies? A message from PROMAC at the National Family Planning Board and the Ministry of Health, funded by the European Union.
Child, I have some guests in studio, and I have a guest online. She is Dr. Simone Spence, public health specialist. I have Mrs. Marion Waysome McIntyre, project coordinator for PROMAC, and Dr. Michael Abrams, obstetrician and gynecologist. Let me start with Dr. Simone Spence. We're talking about PROMAC. For a lot of people, they've been hearing, this is the very first time they're hearing of PROMAC. Talk to us about what falls under your purview.
Hi, Ms. Kitty, thank you so much for having me. PROMAC, as the name suggests, is the program for the reduction of maternal and child mortality, and I'm the overall project coordinator for this project under the Ministry of Health.
Yes.
It is an EU-funded project. The European Union funded this project to the tune of 22 million euros.
Okay.
And it was really supposed to help Jamaica achieve the Millennium Development Goals 4 and 5, which spoke to improving maternal health and reducing child mortality.
Yes.
But the MDGs ended in 2015, and now we're on to the Sustainable Development Goals, and we are still working towards achieving these goals. The specific objectives of the project included helping us reduce the incidence of neonatal and maternal deaths, improving the quality of management of high-risk pregnancies, improving the population health-seeking behavior in relation to maternal and child health, as well as enhancing public awareness and healthcare processes and patient rights. And so this project is really a very huge project, as you can hear by the sum of money that has been allocated, and it actually has 5 different components. Under component 1, where we're looking to improve newborn care and emergency obstetric care in 5 hospitals across the country, we're actually looking to rehabilitate and or construct high dependency units in these facilities. And the hospitals are named the Corner Regional Hospital in Western Region, St. Anne's Hospital in the Northeast, Spanish Town Hospital, Victoria Jubilee Hospital, and Bustamante Hospital for Children in Southeast. So that's one major component. And in addition to this, we're also procuring equipment for these high dependency units as well.
And are we making progress with that? And, how can persons access PROMAC?
Right. So, yes, we are making progress. We have a number of contracts that have been signed under component 1 specifically, and which are now in progress. So we have already completed the design, and so we're just completing the process in terms of the civil work part of the contract, and we expect to break ground early in this first quarter of the year. Under component 2, which speak to the improved quality of primary healthcare services and the referral system, we are looking to renovate some primary healthcare facilities, namely St. Jacob Park Health Center in St. Catherine, Mandeville Comprehensive Health Center in Mandeville, Manchester, and also we're looking at Savlamar Health Center in Westmoreland.
Yes.
But 6 facilities will actually benefit from equipment to facilitate our high-risk antenatals connecting these facilities. So in addition to the 3 I named, we also have equipment for Chappleton and Alexandria Community Hospitals as well as Anoka Bay Health Center. And we've also procured 6 ambulances which are at these sites now assisting with the transfer of patients to and from facilities in that region.
Okay.
So we really have done some work. There's a lot more work to be done because this is a project that has an implementation timeline of 7 years. We started in November 2013 when the agreement was first signed, and we end in November 2020.
Wow.
Now, under component 3, this is where we focus on improving the clinical skills of our healthcare workers. And so we have a number of training programs that are ongoing. At the University of the West Indies, we have created postgraduate fellowship programs for our doctors in the areas of neonatology, maternal fetal medicine, and critical care. And some persons have already been trained and others are currently in training.
Yes.
We also supported training of nurses at UTEC as well as in our own in-service unit in neonatology, midwifery, and critical care. And we're also building the capacity of the primary healthcare team as well in terms of our nurses, doctors, and other healthcare professionals, all with an ambit to improving their capacity to manage maternal and child health issues.
All right, let me get... Yes.
Okay.
Go ahead. No, go ahead, Dr. Spence.
Right. Under component 4, we are looking at improving health-seeking behavior of the target population, which is really persons, women in the reproductive age group and children under the age of 5. And this is where the National Family Planning Board comes in as a key partner and implementer in this area, where we're looking at different health promotion educational programs and campaigns that will inform behavior change. So that, for one thing, for example, women will seek to access care early.
Yes.
Be appropriately prepared for pregnancy and being healthy during pregnancy, so you can have both a healthy baby and a healthy mommy.
Well, let me just bring in Mrs. Marion Wason McIntyre now to talk to us about, because Dr. Spence has listed pretty much the theory, so we want to get to know the practical, of how persons, because it's all well and good to have all of these elements and all of these tenets, but unless people know about it and know how they can access it and how they can use it for their, survival and gain, then, with Dr. Spence said it has been PROMAC has been around since November 2013. The importance of the presence and the role of a father and family involvement during pregnancy.
Okay, all right, Ms. Kitty. Well, as Dr. Spence mentioned, the National Family Planning Board has responsibility for trying to increase awareness in the target population about how they should. 3 things. 1, get fit for pregnancy.
Yes.
So therefore plan your pregnancies and ensure that you are aware of your health status before you get pregnant. 2, as soon as you get pregnant, you access the health service so that we can adequately monitor you. Antenatal care is extremely important.
Yes.
And then the 3rd thing, we also want to look at how these women get the support that they need from the healthcare service, from their families, from the community. So some of the activities that we have been embarking on we are doing a mass campaign that should start later on this year that's going to be dealing specifically with fit for pregnancy and early access to the health centers for care. We're also doing a series of these interviews to try to help women to be more aware of what's happening. Know that PROMAC is around, know that we're here to help. Yes. And also just to give them the information that they need. Now, we decided to use the first session here with you, Ms. Kitty, to deal with family and community support because we know that in Jamaica, we do have an issue when it comes on to family support during pregnancy. Yes. You have a lot of absenteeism with regards to fathers. I know that's, I recall seeing a study recently where 85% of children are born out of wedlock. And then to further exacerbate the problem, you have a lot of these fathers who are not present. They don't live in the same household where the mother is when she goes through her pregnancy.
Yes.
So we wanted to shed some light on this topic, and we brought in our expert.
Yes.
To just help women to understand that there is a link. You have to plan your pregnancies, and in planning your pregnancies, you have to look at what social support you have accessible to you. Do you have the presence of the father? Do you have the father who will play a critical role in this whole process of your pregnancy? We want them to understand that you don't just need the father to provide the sperm. You need the father to be with you throughout the entire process and to be there for the child after.
Yes.
And our focus is on helping women to have better pregnancy outcomes. We want you to go through this in a healthy way, to have a healthy delivery, to have a healthy baby grow up. And all of those things require the presence of the father and the support of the community.
I definitely agree with that wholeheartedly, because the men are important. And again, pregnant, like me, Father God help me. Sometimes I hear somebody about me get a pitney.
Yes.
It's not right for them to say. But 8, 9, and 10 them. You know, me get a youth.
I still don't understand what it means.
No. You know what it means? You know what it means? Because they were not a part of the process. So you're right. You get a child. So if a man says, I have a child, you know, our Jamaicans and our language and the vernacular and the stupidity that permeates the society. Me get a youth. Yeah, you get a youth because you never did it for rub the mother belly. You never did it at the Lama's class. You never got Dr. Abrams at a gynecology visit yet, at the obstetrics something visit.
You were there when the ultrasound was done.
You never did it no time. So you're right. You get a youth. Look here, when them say something and I got lady, me not tell them, it shook me now. Me shook bad. Dr. Abrams, sir, you're the professional, you're the expert here. A lot of people may think, women and probably men alike, may think that it is not really necessary for a man to be present. Does it make a difference, Doc, if the father of the child is present during the pregnancy and after the pregnancy?
It's very important that the father is available and present, not just physically present and available, but emotionally present and available. So that's extremely important.
Yeah.
People don't realize that stress is sometimes effects of stress are sometimes underestimated.
Yes.
And stress during a pregnancy can adversely affect pregnancy outcomes. So, for example, when women are subjected to significant psychological stress in pregnancy, there's an increased risk of having infants that are low birth weight, smaller than they should be.
Yes.
Or premature.
Yeah.
And prematurity has a whole set of other problems associated with it, because premature infants are more prone to develop certain types of infections.
Yes.
They're more prone to develop problems such as ADHD, attention deficit hyperactivity disorder when they're older, visual problems, hearing problems, respiratory problems. So schism and that kind of those kind of interpersonal problems in a relationship at the time of pregnancy can cause issues.
Yes.
It's very important for a woman to be supported during pregnancy, not by just the father, but as you're talking about earlier, by the whole community.
Yes.
And sometimes, for example, when I have a couple in my office, especially having the first child, I'll sit down and talk to them about the fact that pregnancy is going to impact the relationship. It has to.
Yes.
And it can either be in a good way or a bad way. And one of the issues is that there is a gender difference between how men and women communicate. And many men don't understand women and vice versa. But when a woman is pregnant, it becomes even more, it becomes magnified.
Yes.
So, for example, women will go through physical changes, which we know. So they'll gain weight. You normally would gain weight.
And some men can be very insensitive during that process.
Right. So I say, listen, a pregnant woman, especially if she's pregnant for the first time, may go on the scale and say, no, but she's never seen on the scale before. No, and that can
depress her.
Disturbing.
Yes.
After a while, her waistline goes. After a while, she can't see her feet so well anymore. She can't see her vagina anymore.
Yeah.
She sometimes has difficulty sleeping at night because she can't find a position to sleep in.
Yeah.
Pregnancy can be unkind to some women, and they can get skin changes.
Yes.
So between the skin changes and the weight changes, and the facial features may change, like the nose may get broader, the fingers and feet may swell, they may have self-confidence issues.
Yes.
They may say, boy, I don't look attractive anymore, whatever.